Hello, and welcome to the National Council of Juvenile and Family Court Judges Trauma Series, Part 2, Creating Conditions of Healing. My name is Dr. Sean Marsh. I'm the Chief Program Officer for Juvenile Law at the National Council, and my co-presenter for this series is Dr. Alicia Summers, Director of Research and Evaluation at the National Council. Our learning objectives for this session are to identify what trauma might look like in practice, and second, to describe the core conditions of healing. Dr. Summers in the first session talked about the developmental impact of trauma and adversity on individuals across the life course. In sum, we can often say that hurt people tend to hurt people. We'll discuss this more, but in basic terms, it's the idea that fight, flight, or freeze, which is a normative response to threat, when that behavior is engaged in situations where there is no threat, but it's been learned because somebody has survived a lot of trauma or adversity, that we start to see challenging behaviors, that we start to see people act out towards other people. So again, a good phrase to remember when we think about trauma in sum over time is that hurt people, and by hurt people, we also mean hurt oneself, so self-injury. In looking to help folks that have suffered adversity or trauma, we first need to understand what it is exactly that we're looking at. What are these behaviors that we're seeing? To begin to understand this, it's helpful to think about post-traumatic stress disorder, or PTSD, the most severe end of the spectrum in terms of traumatic stress reactions. Now, development of PTSD is associated with an individual's fundamental loss of ability to act on their environment. And second, it's an existentially threatening experience being forced upon someone. The survival mode in response to those threats changes how we interpret and respond to our environment, both short-term and long-term. Some of you might have seen the video of Mick Flanning, a surfer who was attacked by a shark in 2015 during a surfing contest. Mick was fine, he was not injured, he survived, and immediately after the attack gave an interview to the press about the experience. And during that interview, you can very clearly see the amount of stress that he had gone through. He discusses how he felt completely out of control, that he had no say in what was going to happen to him, that he was at the mercy of the event and of the shark, and was very fortunate to survive. But when we think about the criteria of PTSD, again, something being forced upon you is existentially threatening. This is the level of experience that we're talking about when we're talking about events associated with PTSD. Oftentimes we get very lax in our terminology and we start throwing around the term PTSD for events that are technically don't rise to the level of severity that would result in the disorder or the diagnosis. So that's important to remember. And these are the domains that we see associated with PTSD. The first being avoidance. That's simply not wanting to be reminded about the event, the traumatic event. Second, it's re-experiencing the event. And times you'll hear folks talk about nightmares or intrusive memories. They have a difficult time forgetting about what happened to them. They live it over and over again. And the third domain is hyperarousal. And that's the abnormally increased responsiveness to stimuli and constantly scanning your environment for threats. Now, the hyperarousal domain is very important when we are doing work with children and thinking about traumatic reactive behaviors. And in children, if you think about hyperarousal and this idea that their head is on a swivel, they're on the balls of their feet, they're constantly tensed up and ready and looking for the next thing to come down the line or the threat to come down the line, this is pretty understandable that if they lived a life that's been surrounded by threat, they're well wired to be prepared to react, to fight, flight, or freeze to the threat that is presented to them. The problem is when they're trauma reactive and they're engaging in those behaviors when there is no threat present, right? So there's a disconnect there. But that trauma reactive, the hyperarousal, can very much look like another issue, often referred to as attention deficit hyperactivity disorder, or ADHD. Now, children with ADHD are also very on the balls of their feet, have a hard time sitting still, they're constantly scanning their environment, they have difficulty paying attention. This is where knowing the difference between the two is incredibly important, and screening and assessments and evaluations can help us do that. And ultimately, it's important because one of the preferred treatments and a very successful treatment for ADHD is stimulant medication. However, and there's pharmacological reasons why that's the case. However, if you give stimulant medication to a child that does not have ADHD, but is actually illustrating trauma reactive behaviors such as hyperarousal, you're actually making the problem worse. Now, sometimes we'll see, oftentimes and unfortunately, that if a child is diagnosed with ADHD, but they're actually trauma reactive, they're given stimulant medications. They tend to get worse. They don't tend to start healing and recovering from their experiences. And oftentimes the response is, well, we will up the dosage of the stimulant medication or change the type of stimulant medication, which is fundamentally not going to address the trauma reactive issues in that child. So this plays out in schools, and this plays out all across the country, and it plays out within courts. So I think it's a really good illustration of why it's incredibly important to understand what it is we're looking at and approaching it through that lens. No matter how much you try to treat a non-behavioral disorder or a traumatic stress disorder with behavioral type interventions or psychotropic medications or stimulant medications, it's just not going to work out well. And the other way around too with ADHD. So ultimately, it's this over-reliance on vague symptoms that we oftentimes see. And this misdiagnosis is on the reliance of symptoms of anger, irritability, and impulsivity. Those are behavioral symptoms, and they're far from specific to ADHD, etc. So, again, knowing the difference and having screening and assessment tools available are incredibly important. And then it really comes down to this, is that if we're dealing with human beings at the tip of the iceberg level, we're missing a whole lot. It's the rest of the story that we need to understand and be clear about to adequately treat vulnerable populations or populations that have had substantial adversity or trauma. Oftentimes, this is how it plays out. If you were presented with this information about James, who's 13 years old, he's been in mental health treatment. Mom is with a boyfriend who is physically abusive. Not a great family situation. Dad is living with another woman who abuses alcohol. She's emotionally abusive. Then we see that James is having some trouble in school. He stabbed another child with a pen. He's cussed out his teacher. He's not following rules. He's fighting with his peers. Then we learn that he has nightmares. He's afraid to sleep alone. He's constantly worried, constantly calls his parents. Obviously some distress there. Now, at this point in this trauma series, after Dr. Summer's session, and at this point in this session, you might start seeing some red flags here. There's some things going on with James that might indicate trauma. He's having some traumatic stress or trauma reactive behaviors. Unfortunately, this is not what we get oftentimes in the justice system, the court system. This is what we get. We get a petition or a referral that James had cussed at a teacher, he started a fight, he recently stabbed a classmate. Now, if this is all you know, your response to James is going to be fundamentally different than if this is what you know about James. Again, if this is what you get, and this is what you know about James, and this is what you're basing your decisions off of and how to work with and process and dispose of James, it's much different than if you knew this complete picture. And again, that speaks to the importance of screening and assessment and knowing the full picture of James and what's going on in his life. So once you do know that there is trauma or there's adversity, substantial adversity in the life of a child or a family coming before you, what do you do about it? Well, there's three we think of healing or conditions of healing in three domains. The first being safety, and that's eliminating traumatic reminders. So when someone is faced with something that reminds them of traumatic events, they may experience intense and disturbing feelings tied to the original trauma. And those reminders can lead to behaviors that seem out of place but were appropriate and perhaps even helpful at the time of the original traumatic event. It's the disconnect between the events and the behaviors and the lack of threat and that sort of inconsistency that creates behaviors that can be very, very challenging for those that are working within the courts and the justice system. Now, an example of a traumatic reminder is shown here, and this is a van, a transport van that transports children, youth, back and forth between court and the detention center for hearings. And it's a box, so a secure windowless box inside a secure windowless van, and children are placed in this van in this box and transported back and forth. Sometimes they're handcuffed, sometimes they are shackled, But it doesn't take a huge level of imagination to understand that for a child with substantial trauma history, that this might be a trigger. This might be a reminder of certain traumas, and they would engage, and they could engage into reactions and behaviors that can be very challenging, responding to the original threat that is not there, but they are reminded by with this sort of trigger. And we see these kinds of triggers throughout the justice system that we need to be mindful and aware of. Now, when it comes to ensuring safety, I like to show this picture as a reminder that if animals can do it, we can do it. This is a tiger, a mother tiger that lost her cubs. They died within the zoo, and the zookeepers and the veterinarians, being very concerned, wanted to experiment with a proxy set of youth or cubs for her. So they found some piglets, put them in tiger costumes, for lack of a better term, and introduced them to the mother tiger. She adopted them, they adopted her, and they were able to live in harmony and nurture one another. And again, this is the level of safety that we want to try to achieve for our children and our families that come into the court system. And again, I think this is just a good reminder that if these animals can do it, we should accept and meet the challenge of doing it for our fellow human beings. The second condition to healing is agency, or self-determination. If traumatic stress arises out of choices being stolen from a person, then successful interventions must be grounded in giving choice back to that person. Now, this can be difficult to do in the court system, but not as difficult as you might think. Really finding every opportunity to allow someone to have voice and choice in what's happening to them as they touch the justice system can help promote this idea of agency. So when to engage in services, at what time, with whom, on what schedule, those kinds of decisions, the extent you can give them back to folks, to children and to families, the better. Even asking during docketing or scheduling that hearings, does morning work better for you or does afternoon? Are there certain days of the week that are better for you or others? Allowing, again, folks to have some sense of control over what's happening to them at every opportunity. And these don't have to be huge decisions, but they do add up over time. They start messaging to folks that they do have an ability to have some control, exert some control in their lives, which is, again, promoting this condition of healing since they've had choice stolen from them through the trauma they've experienced. The third domain of healing is connectedness, and this is the idea of promoting resiliency. Resilience is simply the capacity to thrive in the face of adversity. It's a function of risk and protection across ecological domains. Ecological domains can be at the individual level, the peer level, school level, community, etc. But one of the important characteristics of resilient children is having at least one significant adult in their lives. Now, what we mean by significant adult is a person of character. These can be teachers, coaches, clergy, probation officers, social workers, a neighbor, a storekeeper. It really doesn't matter. It's the idea that this is an adult that is a person of character. It's a person that can help establish a relationship with the child, and establishing that relationship can help them learn self-efficacy and other important sort of characteristics that promote resiliency. Lastly, courts are part of the healing community, and in doing our work across this country, we learned very quickly that doing this work can be very stressful, and it can actually be very traumatic for folks doing the work. And it's hard to create a healing environment when staff and institutions and communities don't feel safe, aren't engaged, or don't have a sense of control, or are traumatized themselves. So ultimately, it's this idea of promoting the conditions of safety, of connectedness, of agency that are just as important for staff doing this work, because if they don't feel those things, they can't promote that within those that are coming before them that have histories of adversity or trauma. If you're interested in more resources around conditions of healing, please visit National Child Traumatic Stress Network at www.nctsn.org or the NCJFCJ at www.ncjfcj.org. Or if you refer, you can contact either myself at smarsh at the ncjfcj.org address or Dr. Summers at the address on your screen. Our next session will cover some practical suggestions for courts to become more trauma informed in their practice, and for the justice system in general to become more trauma responsive in their work.